This article is from The Diplomat. Taiwan, a country that has been excluded from the WHO for decades thanks to China's political pressure, has demonstrated that the better way to contain the coronavirus is not to suppress news about epidemic, but to make it easier and more convenient for people to access relevant information. Even though Taiwan has not been kept officially informed by the WHO about the epidemic, the Taiwanese government promptly undertook measures to prevent the spread of the virus in Taiwan in late December last year, and organized the Central Epidemic Command Center (CECC) in January 2020. Since the setup of the CECC, it has been holding a press conference almost every day to announce the latest policy and information on the epidemic, and to clarify rumors that are circulating on social media. The Taiwanese government also uses digital tools to communicate with the public amid the virus outbreak. For example, Taiwan's Ministry of Health and Welfare and many Taiwanese politicians of the ruling Democratic Progressive Party (DPP) have used their official social media accounts on outlets like Facebook, Line, and YouTube to keep the public well informed on everything from the number of available face masks to the updated policy. Taiwan's active civil society also plays a critical role in this crisis. To save people time in looking for stores selling face masks, a Taiwanese software engineer built an online real-time map that can show where masks are stocked in convenience stores and drugstores across the island. Following this idea, Digital Minister Audrey Tang, a coordinator between the government and private sector, rapidly developed a better version of the information platform with government data. Another case of civic participation is the engagement of Taiwanese fact-check institutions and groups, including Taiwan Fact-Check Center (TFC) and MyGoPen. They make an effort to fact-check and correct disinformation or misinformation on the epidemic, which mostly circulates online, meanwhile disseminating the right information to the public as third-party independent institutions. Armed with transparent and sufficient information on the coronavirus epidemic, Taiwanese people actively follow the government's policies and take actions to curb the spread of virus individually by washing hands and wearing masks. Therefore, even though the self-ruled island is very close to China, the number of infection cases in Taiwan is still low, 32 cases, as of February 26, compared to neighboring countries like South Korea, 1,261 cases, and Japan, 885 cases. Even though the community spread of the virus in Taiwan is looming and seems inevitable, the Taiwanese government and people have shown that they are determined to work together to fight against COVID-19. The critical factors for tracking and controlling the spread of a virus are time and information. To collect information about the infectious patient's location and their TOCC travel, occupation, contact, and cluster requires rapid reports from individuals, hospitals, and local governments to the Central Command Center. This helps the government control the epidemic and take responsive policies as quickly as possible. In other words, controlling the spread of a virus requires the free flow of information and public information sharing, which runs contrary to an authoritarian regime's specialty of resource mobilization. Instead, what happens in authoritarian countries tends to follow this pattern: the local government hides the truth from the central government to avoid blame, and the central government also lies to its people to deflect public criticism at the beginning of an outbreak. As a result, measures to control the disease are delayed and are eventually in vain. Some might argue that China, as the digital authoritarian powerhouse, has the cutting-edge AI technology and surveillance system to track all its people, not to mention infectious patients. Indeed, these high-tech tools are used to monitor and surveil people in the cities under lockdown. But that does not translate to public knowledge. As the number of infectious cases climbs, China's government ramped up propaganda covering pro-government and pro-Chinese Communist Party stories, rather than communicating with the public. Due to the lack of transparency and accountability, the authoritarian regime's propaganda and regulatory departments tend to take actions to censor and control information. And the results prove that this is definitely not the best public health strategy. To counter and control a viral epidemic, both government and civil society need sufficient information. The characteristics of a democratic society are openness and transparency, which promise the public access to information. On the other hand, a democratic government also has to take responsibility for communicating with people because leaders are accountable to the public. Only when we ensure the free flow of information in a democracy can we construct a healthy society. Besides its strong public health infrastructure, Taiwan proves that the democratic strategy is successful in curbing the spread of the new coronavirus, which is why Taiwan is outperforming its authoritarian neighbor, China.